you were diagnosed with an L4-L5 or an L5-S1 herniated disc or a bulging disc, and you're starting to feel a little bit better and you want to go back to working out, in this video I'm going to show you the 5 exercises that you should avoid at all costs if you're going to go back to working out, whether it's at the gym or at home, and the 5 exercises that you're going to use to replace the ones that you should not be doing. Hi, I'm Dr. Frank Altenrath, and I'm a corrective care chiropractor in Cresskill, New Jersey. And what this channel is about is to give you tips and strategies on how you can take care of your neck and low back pain, pain down the arms, pain down the legs, allowing you to live your life to its fullest potential without any restrictions or limitations. If you're new to our channel, welcome. And if you enjoy this kind of content and you find it interesting, please go ahead and hit the notification bell below, hit the subscribe button so that you don't miss out on any new content we try to put out on a weekly basis. And as with any exercise program, make sure you ask or consult with your medical doctor, your chiropractor, your physical therapist, anyone who's in charge of your care to make sure that it's okay and safe for you to do these exercises. So the exercises that we're trying to avoid are any exercises that put our low back, our lumbar spine into a flexed position, because the flexed position is going to put pressure on the anterior part of the disc, causing it to bulge backwards. Most herniated discs bulge posteriorly and laterally, which means to the back and to either side. So any kind of flexion that we do in a workout is going to add pressure to that disc, bulging it further backwards. So what we're trying to avoid is, this is a lumbar spine, model of your lumbar spine. We're trying to avoid any exercises that put us into a flexed position such as this, which will put pressure on the front part of the discs and then cause a bulging, as you can see here by this red plastic, what represents a disc, bulge to the back or to the side. So that will make your disc worse. And here's a close-up of 2 vertebrae, which would represent the lumbar spine. This is the back and this is the front. So if you're standing here from the side and you bend forward, you can see the bending forward presses the anterior portion of the disc, and you can see the bulge coming out of the side. In this case, it's coming out of the side and touches the nerve root, which will then cause pain down your legs or pain in the back. But the bottom line is, as that disc is trying to heal, any pressure that we put in flexion, flexing forward, is going to increase that pressure on the posterior side of the disc right here, causing that jelly, which is inside, which is a shock absorber. It's going to cause that jelly to bulge out backwards and then possibly touch the nerve, or if anything, start to really damage the healing process that's going on back there. So the exercise that we're going to show you to avoid are ones that are going to take out the exercises that actually put you into a flexed position, and we're going to replace them with exercises that keep your spine more in a neutral position. So the first exercise we're going to talk about to avoid are squats. Now, squats will put your spine into a flexed position, and that's one we absolutely want to avoid. Now we're going to replace the squats with a wall squat, and you'll see an image here of a wall squat, which is going to be more of an isometric contraction of the same muscles, the quadriceps, but you're not going to be moving your back into a flexed position. You're going to be leaning up against the wall for support, a brace, and you're just going to hold a squat in that position, and you'll hold it for about 15, 20, maybe 30 seconds if you can get up that high, if not up to a minute. And do 3 to 4 to 5 sets of that, and try to increase the time. Maybe start with 20 seconds, work your way up to 30 to a minute, and do 3 or 4 sets of those to replace the squat, which we do not want you to do. The second exercise we want to absolutely avoid are leg presses. Now, a leg press, again, you can see here in the picture of a leg press, it's putting your lower back into a rounded position, and as your knees come back, it really puts a lot of pressure on the disc if you have an injured disc. So we want to replace that as well with a wall squat. So these 2 exercises can be replaced by the same exercise, a wall squat. So those 2 things, a squat and a leg press, we want to avoid. Replace it with a wall squat. The next exercises we're going to avoid are deadlifts. Now, deadlifts are one of the most strenuous low back exercises that you can do. And as you can see here in the picture, it puts your spine, your lower back into flexion, and it's going to be very detrimental and can re-injure a herniated L4-L5 or L5-S1 herniated disc that's trying to heal. So you want to avoid that at all costs. We're going to replace a deadlift with a supine bridge. So as you can see here, you're going to be on your back. You're going to put your hands to the side and then arch your back, take your butt off the floor and try to hold a bridge. And we're going to try to hold that position for 30 seconds. I'm going to do about 3 to 4 sets of 30 seconds. As you get more comfortable with this, work your way up to 1 minute to 2 minutes. The fourth exercise that we're going to avoid are sit-ups. Sit-ups, as you can see, also flex your lower back, and we want to avoid those at all costs. We're going to replace the sit-up with a plank. In this case, we're going to do a plank where we're going to be on our elbows and our toes. We're going to plank or lift our entire body off the floor, and we're going to plank our body nice and straight. We don't want to arch our stomach down. We want to keep and not put our butt in the air too high. We want to keep everything nice and level, just like a plank. And you're going to feel the contractions around your entire core, your midsection, your low back. And we want to hold this plank for 30 seconds, do 4 to 5 repetitions. If you can work your way up to 1 minute, that's great. If you can get to 2 minutes, that's really good. But start with 30 seconds and then increase to 45 seconds up to 1 minute and do 4 to 5 repetitions of these, and that's going to replace your sit-up. And the last exercise that we're going to replace are standing hamstring stretches. So as you can see here, standing and bending over to stretch your hamstring is putting your back into extreme flexion, your low back, your lumbar spine. We want to avoid those. What we're going to replace the standing hamstring stretch with is a wall hamstring stretch, where we're going to slide up to a wall, or if you're at home, a couch. You're going to put your legs up against the wall, and you're going to just feel this stretch with your back, and your torso is going to remain on the floor, and your legs are going to be at 90 degrees against the wall or a couch if you're at home. And you're going to just hold that stretch for 30 seconds, and you're going to feel a nice stretch in the hamstring, and it's going to completely be safe for your back because your back is going to be nice and flat and supported by the wall or the floor, I should say. In either case, you're not going to put your back into flex. So these are the 5 exercises to absolutely avoid if you have an L4-L5 or L5-S1 herniated disc or a bulging disc, and make sure you replace them with the ones that I showed you. These exercises are going to be much safer, and they're not going to put your spine in jeopardy of re-injuring the herniation or the bulging discs. If you have any questions, leave them in the comments section below, and I'll get back to you as soon as I can. I hope you enjoyed the information in this video, and we look forward to seeing you again in our next video. Valley Optimal Spine is located on 80 Broadway in Cresskill, New Jersey. Our telephone number is 201-569-1212.